Hi, everyone. Henry DeVries with Health Authority TV. This is the TV show where we help health authorities, those who are involved in the business of health and facilitating it, health tech, health IT, that whole world. And very honored to have Dr. Brandon Hamilton with us today. Dr. Hamilton, please introduce yourself.
All right, yeah, I'm Dr. Brandon Hamilton, giving my complete name. I'm a professor with online students who are pursuing PhDs, or actually practical doctors, doctor of technology, doctor of healthcare, etc., at Capella University.
Okay. And I believe USC is in your background somewhere. Fight on.
Oh, yes, sir. That's right. We're both California folk.
Yeah.
I got an MBA from the University of Southern California in 1991. Really enjoyed that experience. It was an executive MBA. So I don't know if the audience is familiar with the difference between a regular MBA and an executive, but just to bring everyone up to speed, the executive MBA is designed for executives who are already in the C-suite but do not have an MBA. And the courses were thematic rather than just siloed in marketing, accounting, et cetera, thematic. And that was great because everything in business is holistic. It brings in, if you're in the marketing department talking about things, there's accounting conversations going on. If you're in the IT department, you're talking about marketing, So there was overlay throughout that. I had the honor of working with and consulting with Ed Lawler, who the audience might recognize as a person that perfected the bottom-up management model. And my mentor then became Dr. Larry Greiner, a very well quoted organizational theorist from Harvard.
Nice. Yeah, and I too got an executive MBA in the 90s. I got mine from San Diego State University, and I was president of an advertising and PR agency at the time. And then 2 Fridays and 2 Saturdays a month, we were doing this, and then group
That's it.
projects. And it was a second job,
Yeah.
basically a second job. And ours
Yeah.
was, our emphasis was on entrepreneurism because they figured we're not going to go work for the Fortune 500. We were going to start and incubate companies in Southern California, which is what happened for most of us. Okay, so
Okay.
what do you do for those that you help? Why don't you outline your services?
Okay. So, the uptake of coming out of USC encouraged me to consult. I was very enamored with a number of the people that I worked with. In particular, um, I spent quite a lot of time with Warren Bennis. Some people have read
Hmm.
some of his leadership tech, and so he and I used to have a lot of coffee chats together at the Town and Gown there on campus, and it led to my interest in healthcare. And I started to then wonder myself, how could I help with my IT focused background and business background? How could I help the health space? And so I started to realize that the health space, the health industries, as I had met, did not have much of an IT staff. I don't know if it was lack of vision or budget or whatever, but they really did not have an IT staff. And if they had an IT staff, and the IT that they were doing then was outsourced. Now, if they had an IT staff, which was rare, that IT staff didn't know much about cybersecurity. So that's what I specialize in. I have a few certifications in cybersecurity. And I noticed in those early days in the late 90s, and especially now in these last 2 decades, going on decades, that there have been a lot of attacks in the pharmaceutical space. A lot of the cyber warriors were trying to tap into research when COVID-19 was plaguing everyone. And so I began to recognize the vulnerabilities in that pharmaceutical space. And as a matter of fact, there's a corridor just north of O'Hare Airport here in Chicago. I'm in Chicago, everyone. There's a corridor here that is just peppered with pharmaceutical companies, and they were calling me every other week or so, telling me about all the attacks that they've had and what they need to do to shore up. So I helped the health space put together defense in depth strategies that try to protect their perimeter to their networks.
Hey, Brandon, I hear Sway Health, which I attended this year, which is a great group. A lot of the health IT people there um, is going to be in the Midwest, so maybe you and I need to meet up there. Well, let me ask the
Oh, lovely.
question of the day. The question of the day is, what can our nation do to improve healthcare?
Yeah, wow, that's a real tall request, but let me see if I can make a stab at it. The obvious piece, just addressing what I just spoke about, is awareness. I spent some time with the Rush Medical School, which works on trying to train some of their people to be dental techs and health techs. And one of the things that I talked to them about is how technical the industry is right now. And as you know, the challenges have found their way very much in the tech space because of Affordable Care Act. The payment systems is a huge weakness. Many of the private doctors that I talk to that have small businesses tell me that sometimes they don't get payment, especially from their Medicare patients, for 3 or 4 months. I mean, you name me what business can survive for 3 months without getting payment, so they're in financial stress. And that doesn't make sense. It's not that they lack that much business acumen, it's that the payment systems are set up, I think, in a way that makes it extremely challenging to healthcare professionals. So that would be one thing. I would think that they would need to bring in folks like me that can make a pitch to the board, because there needs to be board oversight. I mean, I could talk to CFOs all day long and CIOs all day long, and perhaps they can influence some change. But as you know, sometimes the major decisions that relate to something this dramatic come from the board. And so I would hope that some of these boards would take this on. And how do they do that? You might ask. Well, put someone with technology, or in particular cybersecurity specialty or certifications, on the board. On the board. Their loyalties are are defined by them being on the board, and now the knowledge base is there. They don't have to make an excuse. But that's one easy suggestion, I think, that would help a lot of these healthcare organizations.
Yeah. Well, Dr. Hamilton, anything you want to add before we say goodbye for this episode?
Um, well, I thank you for letting me on, and let me just say that we have to understand that problems in the health space are not just problems for the health professionals and healthcare patients. They're really problems for all of us. We're only as strong as our weakest communities, and so as much as we can do to shore up the community health centers, for instance, and various other community nonprofits, the better off we all are.
Well, well, thank you so much for your wisdom today. And until next time, keep those patients healthy, wealthy, and wise.
All right, thanks for having me, Henry.
Thanks for being here. Bye bye, everybody.